Hello, everybody. To all of the attendees who have joined us and our panelists, welcome to our webinar today on understanding the risks of vaping, a youth-centered approach. We are going to be listening to a presentation from Dr. Nicholas Chaddy on understanding the risks of vaping from a youth-centered approach. So Nicholas Chaddy, MD and MPH, is currently a clinical assistant professor at the University of Montreal. He is a clinician scientist at Saint Justine University Hospital Centre, where he's also the director of the Substance Use and Addiction Program, as well as a co-director of the Gender Diversity Clinic. Dr. Chaddy completed his medical school degree at the McGill University and his residency training in general pediatrics at the University of Montreal. He then completed subspecialty training in adolescent medicine, as well as a fellowship in global journalism at the University of Toronto. He later obtained a Master of Public Health degree at Harvard University and was the first pediatrician in North America to complete a pediatric addiction medicine fellowship at Boston Children's Hospital. His research focuses primarily on the prevention and treatment of mental health and substance use disorders, and specifically tobacco, cannabis, and vaping among adolescents and young adults. He is the first author of the position statements on youth vaping from the Society of Adolescent Health and Medicine and the Canadian Paediatric Society. So yeah, today we're going to be learning about understanding the risks of vaping from a youth-centered approach. So Dr. Chaddy will be presenting on youth vaping as an evolving trend, discussing both the short and long-term health effects. This webinar will take a youth-centered approach and we'll explore both a prevention and harm reduction-based strategy. Just so you know, this is being recorded, but for the attendees, because you don't have your videos on, it won't be anything like that. It'll just be anything that you put in the chat or the Q&A box will be recorded. So just like, I don't know, don't put your credit card information in there, not that you would, but just be aware of that. Also just keep in mind that if you have any questions, you can put them in the Q&A box and I will be looking at that towards the end of the presentation. We'll do a couple minutes of Q&A. If you're having any technical difficulties, maybe just put a quick message in the chat box and I'll try and get that solved for you. Now that I've said my spiel, Dr. Chaddy, take it away.
Thank you, Nikayla, and hopefully everyone can hear me all right. Thanks for joining us today. So as mentioned, I'll be talking about vaping and understanding the risks specifically for youth. Let's see, okay. My slides. Okay, perfect. So I have no disclosures other that I'm a pediatrician working in Montreal and also associated with the Canadian Paediatric Society in many roles. So our objectives, as mentioned, will be to discuss the short and longer term health outcomes of e-cigarettes and vaping among youth. And we'll be discussing how to apply a youth-centered approach for screening and treatment of vaping and e-cigarette use. So let's just start off with a clinical case, the case of a young person, Jeremy, who's 15 years old, goes to high school. He's a soccer player, and he's also the oldest of 3 children at home. He's known for asthma. He has severe and persistent asthma and was hospitalized actually for that 6 months ago. He was recently caught vaping in the school washroom. So when you speak with Jeremy, you learn that he uses a pod mod type vape and that he's recently started smoking a few cigarettes a week as well. He says that he really likes the head rush and the social aspect of vaping. And he tells you that he uses 2% concentration pods and that he'll use approximately 3 pods per week. He says that he would definitely quit smoking, but not vaping. And he says that it helps with his anxiety. So let's see if this talk today will help us try to think of things we could tell Jeremy and how to support him with quitting vaping or reducing vaping, if that's eventually something that he'd be interested in. So I'll start my presentation by mentioning a few recent trends, both in Canada and then more specifically in Saskatchewan. So looking at national survey data, we know now that nicotine vaping is quite frequent, and those are national numbers here from 2019 and 2020, showing that approximately 15% of 15 to 19-year-olds and similar numbers for 20 to 24-year-olds report that they've used an electronic cigarette in the past 30 days. And if we put that into context and compare that to trends that describe cigarette smoking, well, we can see that among adolescents, cigarette smoking has steadily been going down in the past 2 decades, and that vaping really surged in the middle of the years 2010, right? 2015 and starting then. We're starting to see sort of a plateau since the beginning of the pandemic. At least that's what the most recent data seems to show. So now I'd like to share a few slides on a survey from Saskatchewan, the Saskatchewan Alliance for Youth and Community Wellbeing, Thriving Youth, Thriving Community Survey. And as you can see, the numbers here are very, very high. So this is data looking at just over 10,000 students in grades 7 and 12. And here we can see that almost half of young people that age say that they have ever tried in their lifetime at least once, vaping, and a significant number also have tried in the past month. If you compare that to cigarette smoking or other forms of tobacco, you can see that vaping is way up there. And so other findings from the survey show that youth typically vape flavored pods with or without nicotine, but also cannabis and other substances. So up to 55 different substances were mentioned by youth who answered the survey. 2/3 of youth who report vaping in their lifetime also report vaping in the past month. So it's for many youth, not just a one-time thing, compared to just over half of young people who reported ever smoking. So youth who have vaped are more likely to vape again than smokers. 83% of smokers also vaped. So it's something that does cross those two trends, but only 33% of vapers also smoked. So there's a smaller percentage of young people who go from vaping to smoking, but it's not negligible, as you can see, about 1/3. Of all youth who've used tobacco and vaping products, there's a significant proportion that vape and smoke. 2/3 or around there only vaped, and only a small percentage of young people have only smoked. Other elements that came out from the survey in Saskatchewan were secondhand exposure. So there is significant secondhand smoke exposure from friends and at school, and that's a little bit more than in vehicles or at home. For vaping, if we look at secondhand vaping aerosols versus secondhand smoke, we can see that those numbers are very high. So exposure to secondhand aerosols is there, and it's something that is common among youth. So the ways young people acquire tobacco and vaping product vary. So friends, some from a social source for free or from a store, and then a significant proportion of young people who smoke and vape are interested in quitting. And I've just taken a few quotes here from the report. And this, I think, first quote is very illustrative of what vaping is these days for young people. And this grade 11 student said, "Vaping is a huge problem. I mean, huge. Half the time when I go to the washroom, you can't get past the crowds of people vaping in there. Vaping is everywhere in class, everywhere. People need to understand how much it has taken over high school students." And then this grade 9 female student will say, "Get people not to vape around the bus stops. It gives people headaches." So it's not just at school, it's around schools and in so many different settings. So why do young people vape? And this is data from a multi-provincial study looking at data from 4 different provinces across Canada. And so what we've seen here is that most young people vape because they're curious and they want to try something new. And as I highlighted, the vast majority of adolescents are not vaping to cut down or to quit smoking, even though vaping devices were first manufactured or brought forward as smoking cessation or harm reduction tools. So when we think about nicotine's new look these days, and some of you may recognize what brand is hidden here, around the years 2015, 2016, we saw the appearance of these pod-based devices that looked very slick, that looked very trendy. And so, no surprise when you look at these ads that young people would be tempted to try. And just to tell you a little bit more about how these e-cigarettes or vaping devices work, regardless of their shape or their size, they all pretty much function the same way, with a battery connected to a heating element, and then there's a reservoir containing some form of liquid that usually contains nicotine and a solvent, and then some other traces of chemicals and other potentially harmful products that get heated up and transformed into what we call an aerosol. So what comes out of the vape is an aerosol that's eventually inhaled by someone who uses the device. And so looking at the short history of vaping devices, the first ones to come out around the year 2000 really looked a lot like traditional cigarettes, but made of plastic, and were certainly not as effective in terms of nicotine delivery. And then with time, we saw the appearance of pen-like devices, and then tank-based devices that were larger and had several settings on them. And then the pod mods, or the pod-based devices that I mentioned earlier, really started appearing around the years 2015, 2016, when they really came out in the North American market. And you can see different sizes and shapes now And those still remain the most popular ones. And then I'll just mention heat not burn devices, because that's also another type of device that is slightly different, because in electronic cigarettes, the ones on the left side, we're using nicotine salts or dissolved nicotine, but no tobacco. And in heat not burn devices, we are actually using tobacco that we are heating just under the point of combustion. And so those devices are in a different category, or controlled differently, and also have kind of an intermediate risk profile between e-cigarettes and traditional cigarettes. And I think we should keep an eye on those heat not burn devices. And this was taken from a sales pitch from a heat not burn device marketing company, saying that heat not burn device could replace tobacco with synthetic nicotine and tea leaf pellets, and would fall outside the scope of existing tobacco regulations and duties. So there are definitely different ways where these products could evolve and escape some of the legislations and policies around both tobacco and e-cigarettes. But coming back to e-cigarettes, I talked about the pod mods, and let's talk just a little bit more about what they are. And you can see them depicted in the back there. So they contain a little pod, 1 to 2 milliliters of a liquid that usually will contain some nicotine. And since July 2021 in Canada, there's a nicotine cap. So 2% is the legal limit for concentration. And even though this limit exists, the thing is that young people can still access in different ways higher concentration liquids and pods. And so depending on what percentage they find or they use, you will actually see the nicotine content of sometimes up to a pack or even 2 packs of cigarettes in this 1 to 2 milliliter pod. And so using 200 to 400 puffs per pod, you can see that you can get to a lot of nicotine very quickly. And these pod mod devices often will come in youth-friendly flavors, including fruity and dessert flavors and mint that are most preferred by young people. And so there is definitely a discussion right now at the federal level in terms of banning flavors except mint and menthol, as far as I know. So there hasn't been a legislation put out yet, but there is a possibility that that will come. And some provinces have moved forward with different regulations with regards to flavors, but that doesn't change the fact that young people can very often access flavored and high nicotine products, regardless of the regulation that's in place, because actually acting on this regulation is hard, and it's hard to control the market completely. I do want to mention disposable e-cigarettes. Those look very much like the pod mods devices, but they are one-time use. And so this is a graph here with numbers from the US actually showing how disposable e-cigarettes really surged between 2019 and 2020 when there was a flavor ban on pod-based devices across the country. So disposable e-cigarettes are they're here in Canada, and I have many of my patients who tell me that they order them online or they buy them, and we should be keeping an eye on those as they work in a similar way as the pod mod devices, but are only one-time use and sometimes can contain high levels of nicotine. So what is actually found in the aerosol, so what comes out of the e-cigarette, it's a mix of different things, and I started mentioning that at the beginning. So oftentimes there's nicotine, and you can find something that's water-based, so water vapor mixed with that, but then some fine particles, traces of heavy metals, and some cancer-causing chemicals. Very often when there's flavoring, there are traces of chemicals related to that flavor as well, and all of that gets mixed up and inhaled into the lung, and these small particles can actually be harmful for the lung. And I mentioned that some young people will vape nicotine, but some people will also vape marijuana-based products. And we know that approximately 1/3 to 1/2 of young people who use e-cigarettes have tried vaping cannabis. And the problem with that is very often these cannabis vaping products are highly concentrated. And the term dab pen is often used and sort of overlaps with vaping cannabis and refers to the use of cannabis concentrates. And that's something that is on the rise in Canada and is very frequent among young people and high school students. So those are just some examples of some cannabis vaping products. And as you can see, they don't look all that different from nicotine vaping products, and can use oils or waxes and different cannabis-based products. So coming back to the harms and the acute and long-term risks associated with vaping, I've tried to kind of regroup them here into 2 categories. So acute harms, I'll start by talking about those, and those include injuries and due to the inhalation or the ingestion of different vaping products. This can be either primary exposure or secondary exposure. And so I've been involved with a few surveys, actually, looking at cases of injuries related to e-cigarettes across Canada. And so the Canadian Paediatric Society has kind of created these surveys to monitor what's been happening with young people. And what we've seen is in a one-time survey done in 2015, pediatricians across the country reported 35 cases of severe injuries related to vaping products in young people. That was for the year before the study. And then again in 2019, we redid the survey, and this time we found 88 injuries, again for the year preceding the study. And we have a current study now ongoing looking at rates of severe injuries. So this is something that we're very much trying to understand as pediatricians and researchers in the field. And so I'll just share some results from the 2019 study, which I was lead investigator for. And so of the 2,700 or nearly pediatricians in Canada who were surveyed, 42% responded. And as I mentioned, there were 88 cases of severe vaping related injuries. And most of them were related to inhaling the e-cigarette vapor or aerosol. And there were also cases of toddlers and babies ingesting the liquid and having acute intoxication. And so showing up to the hospital or the emergency department with distress or decreased awakeness and so on. And so several symptoms were represented here, and in some cases the injuries were quite severe. There were some ICUs, intensive care unit admissions and hospitalizations, and after the event several young people had ongoing health issues related to the injury. So many of you probably have heard about vaping-associated lung injury. The term VALI or e-VALI circulated a lot in the news just before the COVID pandemic, actually. And so there were several hundreds of cases in the US of adults and young people getting hospitalized because of injuries related to vaping. So they were inhaling e-cigarette aerosols and getting very sick with inflammation and general symptoms and throwing up and feeling very unwell. And so, sorry, I've listed kind of the definition of what that was. We've seen much fewer cases of that in Canada actually meeting the definition, and only 5 of those cases were in youth. What we think is that those events were primarily tied to some forms of cannabis vaping products that contained vitamin E acetate, a specific chemical that was used to dilute the liquids. And so we haven't had many of those cases reported recently. So I think it's just good to keep that in mind and to know that there's so many different chemicals involved in vaping products, and these products evolve very quickly, that we need to keep a close eye on what may happen and different health risks associated with vaping. So something that I have heard quite a bit about in my practice is nicotine toxicity. So young people telling me, I was at a party, I was out with friends, and I started vaping until my pod was done. And then that's how I felt. Stomach pain, headaches, dizziness, decreased concentration. So really feeling very unwell after vaping nicotine in large amounts. And that's something that can last a few hours. Is not known to leave long-term sequelae, but is quite unpleasant and can be associated with nicotine dependence if it's a pattern of regular use. I mentioned earlier the accidental ingestions of young people drinking the liquid. Sometimes e-cigarette liquid will come in a colorful or flavorful little bottle, and so that can be misplaced or young people may think that those are candy or things that they want to drink. So there's caution there that needs to be had. And apologies if some of you are having lunch or having a snack. The next picture is quite graphic, but I've had in my practice some young people have quite severe burns from their e-cigarette actually exploding or malfunctioning. Those are a little bit rarer, but have been described in Canada and the US. And so leg burns or face burns, depending on where the e-cigarette is when this happens. So what about secondhand aerosols? So we hear a lot about secondhand cigarette smoke, but what if you breathe this aerosol from someone who's vaping beside you? Well, there is a little bit more research now starting to show that there are some fine particles in that aerosol and that breathing it could be associated with certain harms. Definitely the nicotine that is in the primary aerosol will also be found in a certain amount in the secondary or secondhand aerosol. And so probably what we can understand from the studies out there is that the more you breathe, the closer you are to the person vaping, the more intense the exposure is, the higher the risks are. And the one example that I like to bring is if a parent is holding a young baby or breastfeeding, and then the young baby is exposed to that secondhand aerosol, there's definitely a risk for the baby's lungs. So that's a good thing to keep in mind. And there have been a lot of questions about vaping and COVID-19, and not so many answers, actually. We do think that young people and adults who smoke cigarettes may have more complications related to COVID if they smoke. It's very limited in terms of data for vaping. And so there was one kind of big study that suggested that young people who vaped were more likely to develop symptoms of COVID. And we can think that this might be just linked to the fact that they may have been vaping with friends and sharing vaping products, which in itself is a risk for catching COVID. So I think we need to just keep an eye on that, knowing that any, smoking and vaping behavior without a mask with other people and sharing products may be associated with COVID risk. So now shifting to longer term harms or chronic exposure to vaping products and vaping aerosols. So I've listed a few of the long-term harms here that I'll discuss in more detail just now. So let's talk just for a second about nicotine itself. So I mentioned the majority of vaping products contain nicotine, and the nicotine contained in e-cigarettes and the nicotine contained in traditional cigarettes is the same nicotine. And what we know of it is that it's a very rapidly moving substance when it reaches the lung and then reaches the brain in seconds, and the effects peak usually around 20 to 30 minutes. So we have a very short period of effect for nicotine, and it stimulates both kind of a psychological and a physiological response. So there are some hormones that get released, and the person in the moment is more alert, the heart rate and blood pressure go up. And in the brain, there's a cascade of different hormones that get triggered, leading to a pleasurable response. And why is nicotine so addictive? And it is because this kind of very quick release of hormones and this very short duration of effects make it that the brain just wants more. And so nicotine is similarly addictive to other stimulants like cocaine, and even more than things like alcohol and cannabis. So another way of looking at this is if you have the nicotine coming into the body and then reaching kind of the brain, you can see that it'll hit some areas that are key to the reward pathway, including the nucleus accumbens, which really helps us as human beings feel good and rewarded when we do something that can be pleasurable in the moment. And then here on the other side of the slide, you can see these little glands over the kidneys that produce hormones that increase heart rate and blood pressure. And so those are all the things that happen at once when nicotine hits the body. But then what happens longer term? It's very hard to study the long-term effects of nicotine because it's quite unethical to say, okay, hey, you young person, use nicotine for several years and then we'll study what happens and we'll compare your brain and different things to someone who doesn't smoke or vape. So we actually haven't been able to do this well. We have some animal models and studies done in animals and kind of observation studies that have tried to understand what are the effects of nicotine long-term on the brain. And what we seem to understand from the research is that using nicotine at a young age will increase the risk of addiction to nicotine and other substances because there are common pathways in the brain for reward and addiction. And then there are several articles out there that suggest that long-term, even though nicotine is a stimulant, the way it will affect how the brain is and develops if it's used when young people are young, well, then there could be some long-term impairments on attention capacity and working memories. And also could be an effect on emotional processing and increase the risk of mood disorders. So definitely things to keep in mind for exposure to nicotine. But oftentimes young people won't necessarily just use nicotine. So this risk can be a shared risk with other substances. And on that note, what we know is that young people who use e-cigarettes, well, are potentially a new group of young people who wouldn't have smoked, so are exposed to nicotine through kind of a new vehicle, and that there is an association, as I mentioned at the beginning, between some young people vaping and then eventually smoking and using other substances. And I've done some work looking at the associations between e-cigarette use and then later cannabis use. And the association is quite strong. And there's similar research looking at e-cigarettes and then alcohol and other drugs. So definitely good to think of e-cigarettes and vaping as one of many substance use behaviors. So what happens kind of concretely in a young person who uses the nicotine? Well, there are some kind of short-term effects, and I mentioned some of those before. And then one thing that is good to keep in mind is that if a young person uses nicotine a lot and regularly, well, if they stop using it, they will get what we call nicotine withdrawal symptoms. And that's what I show here in the orange box. And that becomes a pretty big obstacle for young people who want to quit using vaping devices or nicotine. So having headaches, feeling anxious, anxious and kind of restless and hungry and tremorous. After a few hours of not using can be a big problem if you're trying to focus on a sports practice, or kind of a written assignments for school, or you're on a long plane flight, all those things. So you can see how quitting nicotine may be difficult. These withdrawal symptoms tend to peak after a few hours to 24 hours after last use, and will be present for several days and even weeks, but eventually will get better. I want to open brackets and talk just a little bit about cannabis, because as I mentioned, several young people are vaping nicotine, but also cannabis. And two molecules that I'd like to show to you today are THC and anandamide. And I'm pretty sure that many of you have heard about THC, or tetrahydrocannabinol, which is the active element in cannabis. But perhaps few people have heard of anandamide, which is a naturally occurring molecule that we all have in our bodies, and that actually is just like a cannabis molecule and has very important roles in our body. And so the endocannabinoid system is this system in our nervous system that has receptors for these molecules that look like cannabis. And we create some of those, and we use those molecules to regulate just a bit like a volume control nudge, and some functions and some signals in our bodies. So the endocannabinoid system is used to regulate pleasure and mood and pain and appetite, kind of to bring us back to baseline after we've done something big or bad or good, and then we kind of come back to baseline. This cannabinoid system helps. So if we get cannabis or THC from the outside world, if we vape it or smoke it, then the cannabis molecules will come into the brain and attach to these receptors that our bodies have and that are useful, and kind of wreak havoc in there. And I've just shown here in the side cut of the brain different pink dots of where these cannabis receptors are. And so you can see, if you know a little bit about brain anatomy, that there's a high concentration of these receptors in areas that help us create our memories. So the C-shaped area called hippocampus in the middle, in the back of our brain, our cerebellum that is used for coordination, and then some other parts in the front of our brain that allow us to think rationally. So cannabis can impact all of those functions in our brain. And if you vape it at a high concentration, of course, definitely. So similar boxes to the ones that I showed earlier with nicotine effects and then withdrawal. Well, cannabis does have short-term effects that include feeling good in the moment, having rapid heart rate, and sometimes changes with heat and cold in the extremities, red eyes, dry mouth, increased appetite. And some people get quite unwell immediately with cannabis. They can't focus on anything. Their judgment is impaired. They lose memory. They have even paranoia or hallucinations, right? And then withdrawal from cannabis is quite different from withdrawal from nicotine. Cannabis is a much slower entering and acting substance compared to nicotine. And so it takes several hours and even days before you start feeling withdrawal. But then if you read the list in the withdrawal box, you can see that many symptoms are similar to what you would get with nicotine withdrawal. So you feel quite unwell. And that, again, is an obstacle for quitting cannabis use. So what do we know about longer term effects of cannabis? And there's more and more evidence showing that using cannabis when you're young can lead to addiction, can alter how your brain develops, can actually impair your cognitive performance and your IQ longer term, and may be associated with diminished life satisfaction and emotional problems, and associated with increased risk of mental health problems like depression and anxiety. All right, so then I talked about nicotine, and again, now I talked about THC or cannabis. What happens if a young person vapes both? Well, there can be codependence to both substances, and sometimes there are, or actually oftentimes there are shared risk factors for young people to start using either or both. But then what we know, because nicotine is a shorter acting substance and cannabis is a longer or slower acting substance, well, it can potentiate the effect. So the brain can be tricked into thinking that, cannabis is quicker acting and gives this type of reward. And so it becomes difficult actually for a young person to understand, what are they getting the high from, or is it from both, or is it from one more than the other? And that actually does create another obstacle for quitting. If you're trying to quit one or the other or both, then it becomes a bit messy here. Some other long-term health risks associated with vaping, well, I've listed many here, and because vaping is relatively new, as I mentioned, we've had a lot of vaping in our society only in the past decade or so. We think from the increasing number of studies that there are risks to lung health, to cardiovascular health, to oral health, and there's cancer risk also associated with these aerosols that come out of the vaping device itself. We think that the risk is probably somewhere between no risk and cigarette risk, but really it will depend on how much and how often and what specific types of vaping products young people will use to try to understand those longer term risks. But we think that there can definitely be worsening of chronic pulmonary disease and cardiovascular risk factors like thick blood vessels and coronary disease. And we know that oral health can be impacted with more caries and gingivitis. And we're going to have to wait a little bit to see what the cancer risk is in the long run, but we should keep that on our radar. All right, so if we're working with youth in a clinical setting, in a school setting, in a sports coaching setting, or counseling setting, there's several things that we can do actually to screen for vaping or intervene. And I think the first thing that we should do is think about privacy and confidentiality when we initiate any conversation about vaping or a sensitive topic with a young person. So as a health provider, as a pediatrician, I like to clarify every time I meet a young person what they're telling me, if it's going to be shared with a parent, with an adult, and if so, why. So in Quebec, we have a 14-year-old age limit for sharing information to parents. Every province is a little bit different that way, but we should clarify when we'd be notifying parents. And usually that's when the health of the young person is acutely at risk. And we would encourage young people to be honest and truthful, so that we can kind of lay the ground for a conversation that will be productive and open. So how do you actually screen for vaping? Do you need a specific tool? Do you need to ask many questions? How does it work? And the framework that I like to use is called SBIRT, or Screening, Brief Intervention, and Referral to Treatment when needed. And it's a 3-step process that starts with using a validated question or screening tool to identify the level of risk. And I've tried to find the simplest one out there, which is actually the one that I use. And this tool is called Screening to Brief Intervention. It's a one-question tool. So if you're going to ask just one question to a young person, you can simply ask, in the past year, how many times have you used nicotine or tobacco? And that includes cigarettes, e-cigarettes, or vapes. And then you wait for the response. If you get a response that is in the realm of weekly or more, then there are high chances in a teen that teen actually has a problem with vaping and has developed signs of addiction. And you may think, whoa, just once a week, and then that young person has an addiction to vaping. Well, that's actually what research shows. So if that's what the young person is answering, then there's a need for follow-up and asking more questions. If it's on a monthly basis or once or twice in a lifetime, well, then obviously the level of risk is lower. You should be thinking about asking a question like this to anyone age 12 and above, just based on rates of use in Canada and in different provinces. And you may want to ask the same question. So in the past year, how many times have you used alcohol and marijuana, which are the other two most commonly used substances in adolescence? So if you want to push your discussion a little bit further with vaping, then you can ask questions that fall into different categories, including the types of vaping products, the source, where do they get them, how do they access, what are the substances that are placed into the pods or into the devices, what's the intensity or the frequency, what's the context, are there signs of dependence or quit attempts, and what are the actual impacts of vaping? Does it cause problems at school, in sports, in their everyday routine, their sleep even? So that would allow you to understand the place of vaping in a young person's life. So, all right, you've screened, you did the kind of light blue box at the top, and now you want to intervene. And that can be very brief, can be only a few seconds, a few minutes. And that usually will entail kind of sharing a few or one even health risk related to vaping and kind of trying to initiate a conversation about change. And so some key points for a brief intervention would be really to try to use a patient-centered or young person-centered approach that is based on their strengths. No young person likes to be thought of as a problem, as a behavior. Really, they want to be thought about as an athlete, as someone who's interested in this or that. And that's kind of a good starting point for the discussion. A strong message from an adult or a health provider or a trusted person is to advise all the young people that the safest and healthiest thing to do would be not to vape. And understanding that it might not be possible in the short term or immediate, but it's the best advice you could give them. And giving one or two maybe consequences of vaping, and I've shared several just now, could be a good way to kind of bring a conversation about that. But lecturing young people about the harms of vaping is probably not the most effective technique. It's actually been shown to be a bit counterproductive. You want to be non-judgmental. You want to listen to what they do and why they do it. And then it could be helpful to determine how ready or willing young people are to change. And that could be done using a simple, like on a scale to 1 to 10 question. Are you ready to quit? Or are you willing to make changes? Another way of looking at brief intervention is to ask questions in the 5 A's boxes. That is often a framework that's used for tobacco cessation. So you can ask about the use using some of the questions or the categories of things that I've mentioned: advice to quit, assess readiness to quit, for example, with a 1 to 10 scale. You can assist in quitting, so trying to provide a suggestion or asking young people to come up with their own ideas of goals they could set for themselves to reduce. And then if you have the capacity, arranging follow-up either with you or with another adult or provider to continue that discussion. I've listed a few terms here that I often hear in my practice. Young people will often refer to their vaping devices or e-cigarettes using their commercial name. And I've listed a few, but those constantly change. There are terms used for the liquid that's found in the e-cigarette, like e-liquids or e-juice or juice. I mentioned the term dabs or dabbing to refer to using high concentrated cannabis products in the form of vaping. There are different techniques that young people use. Some people just drip liquid on a heated coil and don't use the mouthpiece, and they just inhale that. And that's obviously more dangerous for burns or injuries. Ghosting is a very popular technique of hiding the actual aerosol in your lungs when you're in a public place so that nobody actually realizes that you're vaping. And dosing is a term that we hear more here in Quebec for young people who will actually plan to use a set quantity or amount of nicotine to get certain effects. And I mentioned, some effects of nicotine, like nicotine toxicity. But before you get there, some young people will describe getting nicked or getting the euphoria from the nicotine when they get this intense head rush and high from using a lot of nicotine. And then getting nick sick or nicotine toxicity is when you kind of overdo it, I guess. So how do you actually approach cessation or treatment for young people who would like help or are willing to quit or reduce? Well, it's not clear what are the best strategies to help support young people who'd like to quit using e-cigarettes. But we do have quite a few years of experience supporting young people quitting smoking. And there are some guidelines out there to describe that. And I think that while we're still learning more about how to support young people with an addiction to vaping products, we can definitely use some of the smoking cessation strategies. And as I mentioned, screening is very important. We want to send a strong message that abstaining is the healthiest, although not always possible. We don't want to recommend e-cigarettes for smoking cessation. That is something that has come very clear, and professional societies in North America are really unanimous on saying that there is no convincing evidence that for young people, e-cigarettes would be effective smoking cessation tools. There's a risk, on the contrary, that they may develop stronger addiction to nicotine or even go from one product to the other. We do want to we offer counseling because talking about it and behavioral strategies seems to be kind of the first step for quitting smoking and vaping. And there are some pharmaceuticals that we can consider as well, which I'll talk about in a second. So, what are the promising approaches for vaping cessation based on the literature? Well, motivational interviewing, which is kind of a way of talking with a young person, trying to find their own motivations and seeing eye to eye with them on what could be realistic to do, seems to be the best approach to start with in an office setting and a one-to-one setting. Individual counseling with repeated visits can be done. Vaping cessation apps, phone lines, chat lines, quit lines exist, and I'll share a few resources at the end. Biofeedback is done by some, or cognitive behavioral therapy, so some more experimental therapies, including mindfulness also, that can be used for strategies to deal with withdrawal. Some people will use nicotine replacement therapy, and I'll talk about that in a second, or other medications. And some people may be tempted to suggest lower nicotine concentration products, sort of as a harm reduction approach. It's controversial. Some people will say if you use something that's less concentrated, then you may be actually vaping more, exposing yourself to higher volumes of chemicals. So I think we still need more research in seeing how we can do that and how we can do that safely with young people. But if we want to consider nicotine replacement therapy, it definitely is a safe way to replace the nicotine from the e-cigarettes and try to fight against those withdrawal symptoms and those cravings when young people stop. And the recommendations from the Canadian Paediatric Society and from other societies are to combine a short-acting and a long-acting nicotine replacement. Short-acting like lozenges and gums, long-acting like patches. In pediatrics, we or for young people, we usually don't recommend sprays or inhalers because they just haven't been shown to be effective. Side effects are usually mild, and it could start with lower concentration products for people who are, or young people who are lighter or smaller. How to find the equivalent in terms of how strong a patch, in terms of how much a young person is vaping. Oftentimes it's a bit of trial and error. My kind of gestalt is to go with 1 pot a day is usually a full strength patch. And then if you go under that, maybe you'll try with something a little bit milder and try to adjust that with the young person. And there are some calculations in terms of trying to convert milligrams of nicotine salts in strength of a patch, but because products vary a lot and sometimes what's on the label is not necessarily what's in the product, it can get tricky. But definitely it is something that is there as a tool for young people who are motivated and feel like they can't deal with withdrawal symptoms. There are also other medications that are used in smoking cessation that can be tried. Bupropion is one, varenicline is another one. Those two are commonly used in adults, less so in young people, and tend to be safe. There's some contraindications that should be watched, and this should definitely be discussed with a medical provider with some experience with these medications before being suggested to young people with addiction to vaping products. When it comes to the treatment of cannabis dependence and withdrawal, well, there are no medications that are approved for that. And again, motivational interviewing, so one-on-one discussions, trying to find motivations for a young person to quit or cut down should be the first line. There's some experimental treatments out there, but those really still need to be researched a little bit more. And again, there could be some harm reduction strategies like using lower concentration products or products that are from the legal market instead of the black market. But then again, we need more research about how to do this and do this well. So I'll just share a few resources now. So it was mentioned earlier on that I was the lead author on a recent position statement from the Canadian Paediatric Society that really details the core of my discussion today, as well as some strategies to help support young people with cessation. So if you would like to read more about that, those are available for free online. And the Canadian Paediatric Society actually has a nice resource page, including a clinical tool that summarizes kind of key questions that clinicians can ask to screen about vaping. So that could be something nice to print out or have handy if you work with youth and would like to have those conversations. The Caring for Kids platform, which is a parent information platform, from the Canadian Paediatric Society, again, has some interesting facts there, so that could be another resource. Some more resources, again, from the Canadian Paediatric Society related to cannabis. Again, position statements on how to counsel youth and parents about cannabis and what to know as health providers or youth serving providers on that regard. There's some additional reading also, some articles that I've written in terms of understanding cannabis, vaping, and some other risks related to vaping. Health Canada has some good resources that are usually quite up to date in terms of how to counsel parents to talk with their teens about vaping. So those could be interesting to check out. And our neighbors down south do have some good also some good documentation if you'd like to look into a nicotine replacement a little bit closer, and those are tailored to youth, so it could be interesting as well. There's some French language resources out there, mostly from Quebec, that are also there for free on our provincial platform, Quebec Sans Tabac. And so those are there. And I didn't include a slide here, but I guess I should have. There's an interesting app from the Lung Health Foundation called Quash, which is a free app available in French and English to help support young people quit vaping. So Quash, as it said, is something that's worth checking out for young people who may be a little bit more tech savvy and would like some support. So to conclude, just some key take home or key points for today. As we discussed, e-cigarettes most of the time will contain nicotine and flavoring agents, and they do carry several short and longer term risks that should be discussed with adolescents. And we mentioned age 12 is a good kind of minimum age to start discussing those things. Cannabis vaping is now quite common as well, and often will involve the use of high potency products. So we should keep an eye on that and also counsel young people about the risks of cannabis vaping. As I explained, screening for e-cigarettes is quite simple, and using a single question that's been validated, usually asking about how many times in the past year a young person has used, can give us a good hint of if there's a problem there or not. And then treatment approaches or kind of interventions that are applied or applicable for cigarettes can be applied and modified and adapted for e-cigarette use. So I'll stop there for now and take any questions that you may have. And I'll thank you for your attention. This is just a quick picture of where I am at right now in Montreal, where it's cold and snowy.
That was awesome. Wow, thank you so much. I learned so much. If anyone has any more questions, you can put them in the Q&A box, or you can raise your hand, and then I would be able to unmute you and you could ask your question verbally. I have collected a couple questions that have come through since we started. The first one is vaping without nicotine/cannabis bad for teens?
It is. It is for many reasons, and I think that's a really important question. As I mentioned, what you'll find in the aerosol is water vapor if it's a nicotine-based product. There's usually some other type of vapor for cannabis products that are oil-based. And then you'll have a set of chemicals, different products that in small or large amounts can be harmful for the lungs. So the long-term health effects are yes associated with nicotine, but also to these chemicals. And it may be tempting to say, well, vaping is so much cleaner than a traditional cigarette. There usually is no tar, but there's still a very extensive list of chemicals. And those very acute cases of people getting ill with what we call VALI or E-VALI, we're not linked to the nicotine, and we're not linked to the cannabis itself, but mostly to other chemicals and products found in the e-cigarette liquid. So definitely there are some risks. The risks are different when you have or don't have nicotine and cannabis, but they're not harmless. And also you wouldn't want to encourage the behavior itself using a vaping device, which may lead young people to try with cannabis or with nicotine or even other substances.
Okay, that makes total sense. The next question that just came in, how would you approach a youth who is not concerned about the health risks and does not want to quit or thinks the amount they vape is not affecting them?
Yeah, that's happened quite frequently in my practice. And really, this is kind of the art, I would say, of motivational interviewing. So it may be that a young person who's in kind of motivational interviewing speech is pretty contemplative. So they really don't want to contemplate change. They're kind of happy where they are. They have benefits from vaping. It's social. It makes them feel good in the moment. So you may want to just explore with them what are the pros and potential cons of vaping. And an obvious one is that it'll cost them money, right? It's very rare that young people will be able to vape large amounts for free. If they can, well, good for them. But there probably is going to be at least one downside that they'll be able to kind of name or come up with. And it's rare that young people like the idea of being addicted to something because it reduces their freedom, right? They can't quit, or if they have to take the plane, well, they're kind of stuck with that addiction. So you may want to just gently explore on a first conversation what may be the downsides, and kind of keep back at them every time you'll see the young person, staying consistent with your message and just saying, the healthiest thing you can do for your brain is not to use, or for your health is not to use. And some people will choose to use and some people won't, and share maybe one, maybe two of the health harms, not more than that. Not going too hard, and then eventually you'll have a good conversation. And you may want to ask if this young person specifically hasn't had problems with vaping. Maybe they're aware of some of their friends who've had. Maybe it's gotten their friends into trouble. It's sometimes easier for a young person to discuss someone else than themselves. So those are other strategies that can be used. But definitely conversations should be non-threatening, non-judgmental, and hopefully a way to have a certain dialogue with young people.
Okay, that's awesome. The next one, is vaping considered a gateway drug?
I get asked that question a lot. And I do have a problem with the term gateway, because if you look at the research and the statistics, it really isn't all young people who vape who will then go on to use other substances. Some people will actually just vape one time, not like it, and that'll be that. So the term gateway sort of kind of entails that you're moving on to substance use. But in the sense that vaping does increase your risk of using, well, vaping and other substances, yes, of course, there is a strong association. We've seen this with studies that have looked at young people in time. So saying that vaping once is harmless would be a tricky thing to say, because in the kind of big pool of young people who will vape once, well, there's a proportion that will vape again, and another proportion that will vape again and again and again and have trouble with it. So although I don't like the term gateway, you can say that definitely e-cigarettes and vaping does increase your risk of having trouble with nicotine and other substances in the long run.
Okay, that's good. The next question is, how do you spell the app Quash that was suggested?
Oh, Quash, Quash, Quash. I think is it quash.org? I really should have included that in my slide. But if you look at quash and vaping cessation into Google, you'll definitely find that.
Okay, I put that in the chat. Does vaping work as a way to facilitate cigarette smoking cessation?
Well, so the question really is two questions, because vaping can be considered as a smoking cessation tool for adults. And that really was kind of the initial idea. The research really still needs to come and come stronger. It looks like vaping can be an effective way to quit smoking, but it's not all that clear if people who quit smoking the cigarettes will eventually quit the vaping or will stay on vaping for a long time. For some people, yes. For some people, maybe not. And when we shift the question to young people, as I sort of alluded to in my talk, there is a chance that young people will, if they switch from smoking to vaping, then move on to use more of the nicotine or use both. And then obviously, if you have both products, there's kind of a longer list of chemicals that come into the lungs. And then it really is a question of trying to understand the individual's risk. So if they actually went from smoking 1 cigarette a day to vaping 2 pods a day, then it would be hard to argue that we've actually done effective smoking cessation. Well, yes, they're not smoking anymore, but they're vaping a lot more. And the risks could be comparable, even worse with the vaping. So it really is difficult to say. And as I mentioned, we don't have research now suggesting that young people with still developing brains, so teens and even young adults, like before the age of 25, would clearly benefit from e-cigarettes for smoking cessation. And as I mentioned, that's different from older adults. And we still need some more research, even for adults, to say what's the best way of using e-cigarettes for smoking cessation, if that's what we're going to use it for.
That makes a lot of sense. Maybe we'll just do 1 or 2 more, just being cognizant of the time. If there is a teenager who is insistent on vaping, is there any way to reduce the harm?
There is actually. And so clearly, if you're vaping less, you're reducing the harms. So if a young person does not want to quit, perhaps they're willing to reduce the number of pods, they're willing to reduce the number of days of use or the different settings where they use. So it may be that, young people really need to want to vape with their friends socially, but the vaping they do alone at home is maybe not as essential to them. So there's definitely some conversations that can be had with reduction. Clearly, if young people are going to buy products that are unverified from the black market, that have higher concentration than what's allowed as per federal regulations, that would be something that should be discouraged. So because these cases of acute lung injuries were thought to be linked to less regulated products, already using products that are in legal sale would be a step forward. And then trying to reduce the concentration isn't a bad thing. As I said, it's tricky if young people are using half the concentration, but twice the amount, then are you really reducing the harm? That's a good question. So there definitely is a way to have productive discussions with youth who don't want to quit, but may want to stop. And one thing that I like to offer is kind of an abstinence trial as a way to challenge themselves and also to realize if they do or don't have a severe nicotine addiction. So, asking, when was the last time that you spent a whole day without vaping? And do you think you can challenge yourself doing that? Is that something you can offer yourself? Is that something you can try to see if you actually are addicted or not? And that very often is quite eye-opening, and you'll come back to that a few weeks after and they'll be like, nope, couldn't do it. And then you have stuff to discuss, right? Not necessarily that they're going to want to quit right then and there, but it already brings the discussion to a next level.
Okay, this will be the last question that I'll read just because we're running out of time. What are the effects/risks of vaping in an enclosed space, such as inside the home? And how could a youth escape these harms if it is a parent creating the secondhand exposure?
Wow, I wish I could find the answer to that problem, right? And clearly, the smaller the space, the more enclosed the aerosol is, the higher the risks. And that was clearly shown for smoking and secondhand smoke. And there are very good studies showing that just the fact of seeing your parents smoking or vaping or being exposed to that vapor without even talking about inhaling it or breathing it, does increase your risk as a child or as a teen of going towards trying these substances and potentially having substance use problems in the future. So clearly, if parents can reduce the number of times or the circumstances or situations where they vape close to their teens, and sometimes it's parents, but sometimes it's siblings and sometimes it's friends. So trying to kind of bring more awareness that this kind of fruity smell that comes from a flavored vaping product is not a healthy aerosol. Yes, there are risks with direct inhalation and indirect. People just need to know. And once you start discussing that, well, awareness does come. So I think talking more about it, making people aware, opening windows so that there's more air circulation could be a good way of reducing some of those fine particles that are in circulation. But clearly, vaping indoors should not be recommended. Vaping in cars should not be recommended either for all these reasons that I mentioned. So yeah, I guess the ideal would be not having exposure to other people's aerosols, but in the impossibility of achieving that, at least talking about it and finding ways to reduce the amount of vaping, the proximity, and increasing kind of air circulation would be a good place to start.
Hey, this has been so wonderful. Thank you so much for joining us today. I don't believe there's any more questions or anything. Thank you to all of the attendees for joining us over your lunch hour. We do really appreciate it. And if there's nothing else, then I guess I'll let everyone go. Thank you so much.
Thank you, everyone. Have a nice day.